Medication documentation in home health isn't just about paperwork. It's about patient safety, compliance, and protecting your license. One mistake can lead to serious consequences, from medication errors to audit citations. So how do you ensure accurate and thorough documentation every time? In this video, we're breaking down the essential steps for proper medication documentation in home health. Whether you're a nurse, therapist, or home health professional, these tips will help you stay compliant, avoid costly mistakes, and improve patient outcomes. Let's dive in. Maintain an up-to-date list of all the patient's medications. This list should include prescription medications, over-the-counter medications, vitamins, supplements, and herbal remedies. The medication administration record is a form used to document each medication administered to the patient. It includes the following information. Medication name lists the name of the medication. Dosage. Record the specific dosage or strength of the medication. Route of administration. Indicate how the medication is administered, e.g. orally, topically, intravenously, etc. Frequency. Note how often the medication is taken, e.g. daily, twice daily, as needed. Date and time. Record the date and time of each administration. Signature. The healthcare provider or nurse administering the medication signs or initials to confirm administration. Any missed doses or refusals. If a dose is missed or refused, document the reason and any action taken. Medication reconciliation. Perform medication reconciliation to compare the patient's current medication list with the ones on file. Identify any discrepancies or changes and update the medication list accordingly. Allergies and adverse reactions. Document any known drug allergies or adverse reactions that the patient has experienced. Include details about the type of reaction, date it occurred, and circumstances surrounding the event. Medication education. Provide medication education to the patient and caregivers. Document what was discussed, including medication names, dosages, administration instructions, potential side effects, and the importance of adherence. Medication changes. Document any changes in the patient's medication regimen. This includes adding, discontinuing, or adjusting medications. Specify the reason for the change and any new instructions. Medication storage. Verify that the patient is storing medications correctly and safely. Document any issues with medication storage that need to be addressed. Medication adherence. Monitor the patient's adherence to the medication regimen and document any concerns or challenges. Address non-adherence with appropriate interventions and communication. Controlled substances. If the patient is on controlled substances, document their administration, including the dosage, date, time, quantity, signs of dependency, effectiveness, side effects, storage, and any required safety measures. Communication and care coordination. Ensure that all medication-related issues are communicated among the healthcare team members, including physicians, pharmacists, and other providers involved in the patient's care. Medication Documentation Summary Guide. Is the medication profile consistent with the plan of care, complete with pharmacy information, allergies, height, and weight, and updated at start of care, recertification, resumption of care, OASIS follow-up assessment, and as needed? Ensure all the medications listed on the medication profile match those in the patient's home, OASIS, and the plan of care. Update the medication profile with all current, changed, and new medications at the time of the assessment. Include start dates and end dates when indicated. The letters L, C, N are often used as follows. Long-standing medications, L, changed medications, C, and new medications, N. Remember that a new medication is considered new for 30 days. A changed medication remains changed for 60 days. A medication is considered long-standing if it has been new for more than 30 days or has been in change status for longer than 60 days. For all PRN medications, indicate the reason why the medication is prescribed. For example, acetaminophen every 6 hours as needed for pain. Ensure that medications are listed on the med profile with the same name as listed on the dispensing package or bottle in the patient's home. Do not put down the brand name on the medication profile for a generic medication at home and vice versa. Do not go off of the discharge list given to the patient from an inpatient stay. Often, some of the medications on the list have been called into a pharmacy and have not been picked up from the pharmacy yet. Only record medications currently in the home. Document the medications pending pickup in your narrative and communication note. The assessing nurse must write out each medication as is on the bottle and not go off of a word of mouth or a list handed to them by the patient or family. Do not include medications not yet picked up from the pharmacy. Have an inquisitive mind. When in doubt, clarify. If a patient has 3 bottles of 3 different narcotics, all scheduled, be curious enough to ask more questions. Look at the bottles to see if they are all prescribed by the same doctor or different doctors, and immediately clarify with the PCP. It's possible that the patient may be seeing 3 different doctors for different issues, and all have prescribed the same or similar medication. The nurse should call the PCP prior to leaving the patient's home for any discrepancies noted. Double-check all medications to ensure the patient has not received an order for or has picked up from the pharmacy a medication they already have been taking under a different drug name. This happens a lot when a patient is seen in the emergency room by a doctor different from the patient's PCP, or when a patient has multiple specialty doctors and/or uses multiple pharmacies. Find out how and who currently manages the patient's medications. Assess if the patient needs assistance with medications set up using a pillbox. Find out if there are any financial issues with obtaining meds, and make appropriate referrals, example to a social worker, for financial status evaluation and assistance. Have the nurses do a medication compliance check to ensure that the patient is being compliant with the medication regimen. For example, check when medications were started versus the number of pills left in the bottle. Check Pillbox for skipped days to determine compliance. All medicinal or alternative treatments should be listed with the medications. This includes normal saline, oxygen, neosporin, nutritional supplements, over-the-counter meds, and all herbal medications. Assess for drug or herbal contraindications and inform MD immediately of medications being taken by patient without a prescription. If the patient is on a medication that typically requires lab draws, and the patient is currently not on any lab draws, call MD to inquire. The PCP may not be aware that the patient is taking certain medications in cases where the medications were ordered during a hospital stay or emergency room visit and patient was advised to follow up with PCP but did not. Report all lab results, both normal and abnormal, to MD immediately for effective drug therapy adjustment if needed. Include the name of the pharmacy and phone number. This helps when a medication needs to be clarified or refilled. Include the patient's age, height, and weight. These come in handy when a medication has been ordered that requires calculation of dosage by patient's age, height, and weight. The medication profile must be signed, dated, and initialed by an RN. All changes made on the medications on the med profile must be communicated and faxed to MD for review. All classifications and indications for the medication need to be included. All new medications must have a start date. All changed and discontinued medications should have the date when the meds were changed or discontinued. In case of an error, do not write over it, use white out or black out the error. To correct a handwritten error, draw a single line through the error, initial and date it, then make your correction. All allergies that the patient has must be indicated in the medication profile. If no allergies, do not leave blank, put no known allergies. Ensure that the proper route for administering the medication is indicated. For example, G-tube medications are not accidentally listed as oral. Avoid using abbreviations that can create confusion or medication errors. Instead of QD, QOD, IU, write it out IE, daily, every other day, international units, etc. Indicate dosage, how many tablets to be taken, how often, and duration to be taken when applicable, e.g. with antibiotics, tapered medications, etc. Do follow-ups on medications that were prescribed but not available during the last assessment. Were medications picked up from the pharmacy? Does the patient have someone to help pick the medications up? If the patient goes for dialysis, do care coordination and reconciliations to see if there are any medication changes made during dialysis visits, and if there are any specific medications the patient receives only during dialysis visits at the dialysis center. Check for expired meds and discard all expired meds appropriately. Assist the patient to separate refills arriving in the mail before the patient is completely out, to avoid double administration of the same meds. Assess for any medication-related risks, such as blindness, dependency, unaccounted for missing medications, especially narcotics, mislabeled bottles, increased confusion and/or forgetfulness, etc. Report immediately to MD and case manager so that appropriate referrals can be initiated to assist in long-term medication management. Ensure that medications are stored appropriately. For example, all medications that require refrigeration are refrigerated. Ensure all inhalers, liquid, and ointment medications are dated when they were open. Some medications' expiration dates are calculated from the date they were opened, such as insulins, eye drops, ointments, normal saline, hydrogen peroxide, betadine, and other wound cleansers, etc. This helps to know when they should be discarded. Report all issues and concerns to MD and document promptly. Ensure that the patient is instructed on expected common side effects of certain medications such as easy bruising with anticoagulants. Instruct on food and drug interactions, drug-on-drug interactions, contraindications, and adverse effects that need immediate attention. Ensure that the patient is monitoring and keeping a record of vital signs for those medications that require vital signs checked before administration. Explain parameters to the patient and when certain medications need to be held. Evaluate med compliance. Check pillboxes and bottles to see if medications are being properly taken. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. If you're looking for helpful, downloadable digital resources on home health management, visit my Etsy shop, link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.